Here's another chat with Dr. Abrams, and today our topic is bone and joint health. So, good morning, Dr. Abrams. Let's go ahead and get started. So, our first question to you today on this topic is, what are some of the common issues with our bone and joints as we age?
Certainly, as we age, we are at risk to get our bones less mineralized. So osteopenia is the beginning of that, where the bones are less mineralized and hence less strong than they used to be. And then osteoporosis is the final end product, where people are at risk for fracturing very easily with minor trauma. So that's what happens to our bones. Our joints, often just through wear and tear of aging, become the cartilage that separates bone from bone becomes deteriorated, so that we have bone on bone, and that can be painful. And this is arthralgia is pain, arthritis is inflammation of the joints. So they get red, hot, tender, and swollen and deformed. I personally have a good example of that's osteoarthritis, which is just from aging.
So what are the early signs of some of these issues? Maybe you can cover starting with osteopenia and then getting into the arthritis side.
I think, again, for the arthritides, it's pain, swelling, redness, heat, tenderness to touch. Those are all evidence that there's some inflammation going on in the joints. The osteopenia, osteoporosis, I don't think there are really warning signs. That's why people get the so-called bone density scans to see where they stand, because there is no real clinical impact of that until you fall down and easily break a bone and then are found to have either osteopenia or osteoporosis.
Can some of these issues precipitate earlier or aggravate if people are dealing with chronic illnesses such as cancer?
Certainly, anybody over the age of 50 already is at risk for bone issues, demineralization, because as we age, our hormones, both estrogen and testosterone, are important for keeping our bones strong and healthy. And as we go through menopause, or as some people like to call it, andropause, for men, our bones tend to become a little less strong and mineralized. For our cancer patients, even before their age 50, if they're treated with hormonal manipulations, for example, for estrogen receptor positive breast cancer or for prostate cancer, that puts them at greater risk for demineralization of bones, osteopenia, and osteoporosis. Our cancer patients also, again, women with breast cancer, postmenopausal or premenopausal, taking aromatase inhibitors, tend to get a lot of joint and muscle issues. And those, we try to treat as we treat arthritis as well in people that are older. So, yeah, those are the problems that my cancer patients would be suffering from.
Okay, so how should one think about bone and joint health, particularly when it comes to nutrition, exercise, and supplements? What do you think?
I think you're saying exercise is a really important thing, because for bone health, we really do need to do resistance exercise, work with bands or weights. We think about aerobic exercise, that might be good, but the resistance work, first of all, keeps muscles toned and keeps bones mineralized. So I know that there's a whole exercise regimen for people with osteoporosis that really focuses on resistance work. That what really helps keeps bones mineralized. Joints, I think yoga, is a really good intervention for keeping joints flexible and mobile. I know my personal trainer, when I see him, we do 20 minutes now of just joint mobility. So supplements, I think, are important as well. So the bones are mainly calcium, as we all know, and calcium is something that's most present in our diet in the form of dairy, which is something that I often suggest patients avoid who have cancer or otherwise, in fact. But so the dairy being the greatest source of dietary calcium, I often recommend my patients take a calcium supplement. Calcium constipates and magnesium does the opposite, and they're both good for bones. So I recommend people take a calcium magnesium supplement. Usually has twice as much calcium as the magnesium. So you balance the bowel effects, and they're both good for bone, and they both decrease the risk of colon cancer. Studies have shown, however, that men taking high doses of calcium supplements are at greater risk for more aggressive prostate cancer. So where I usually recommend for postmenopausal women a calcium supplement in the range of 1,000 to 1,200 milligrams a day, for men I prefer 300 to 500 milligrams if they still have a prostate. The other important supplement for bone health, of course, is vitamin D. Vitamin D is a pro-hormone, actually, that we get from the sun, but people over the age of 50, overweight, and with more pigmentation are at greater risk for vitamin D deficiency. There are many supplements that combine vitamin D with calcium. However, vitamin D is a fat-soluble vitamin, so it's best absorbed as a gel bead or liquid and not as a white powder in a capsule or a tablet, as often those vitamin D calcium combos are. So vitamin D increases the absorption of calcium and puts that hopefully into bones. Many people are now saying that no, you're at risk of getting vitamin D depositing calcium in your arteries, particularly your coronary arteries and your aorta, if you don't take it in conjunction with vitamin K2. So this is something that I'm just starting to think about a little bit more. I don't like people overdosing on supplements. So I'm cautious about recommending K2 to everybody that I recommend vitamin D3 to, but it's something that many of my patients are already doing. For joints, one thing that I like, particularly for those women on aromatase inhibitors, is acupuncture. I think research has shown that acupuncture can be useful for women who get the musculoskeletal symptoms associated with aromatase inhibitors. I also like omega-3 fatty acids in fish oil. Fish oil is an anti-inflammatory and a little bit antidepressant. And certainly if you're suffering from joint pains, a little antidepressant boost would be useful as well. So I'm a big fan of fish oil. The other thing that has sort of a mix research findings is glucosamine and chondroitin sulfate. I've been taking it for years. Research often says it doesn't work for arthritic pain. I think that research is looking at hip and knee more than hands and feet, which is where my issues are located. So I think glucosamine chondroitin is certainly something people with arthritis should think about trying. Turmeric is known to be an anti-inflammatory. And for me, when I had a big flare of that arthritis, a turmeric and black pepper combination really worked wonders for me. The turmeric is not well absorbed from the gastrointestinal tract, so it needs to be either modified so that it can get absorbed from the stomach as opposed to getting all the way down into the colon, or it needs to be taken with a black pepper component called piperine. Curcumin is the active ingredient in turmeric. So many of these preparations are specifically curcumin or curcumin and piperine. The caution here is that if you're taking a lot of prescription medications, the black pepper in that turmeric or curcumin piperine complex is going to increase the absorption of everything else in the stomach at the same time. And so I often caution people taking a lot of prescription meds that we don't want to get overabsorbed and become too toxic to perhaps take a modified form. A Meriva is one form of the turmeric that's out there. So turmeric I found to be very useful for inflammation and arthritis.
Any other advice you'd give around caution on the supplements that you've mentioned in terms of risks?
Yeah, I think we're in an era where vitamin D has become very, very popular to supplement. And I see patients whose vitamin D levels are way too high. What it is too much calcium. And that leads to neuropsychiatric difficulties, to gastrointestinal problems, including abdominal pain, constipation, as I mentioned, pancreatitis. It also can lead to kidney stones and dehydration and kidney failure. So it's not to be taken lightly, either taking too much calcium supplementation or taking too much vitamin D. With regards to the other supplements I mentioned, fish oil, often I'm told by my patients that they were told to stop taking their fish oil because it puts them at greater risk for bleeding. And again, because it's anti-inflammatory and may block platelet clumping, fish oil is something to be a little concerned of if it's taken, I think, in doses more than 4 grams a day, which I'm usually not recommending.
Another great session, with a lot of learning about things that could support joint and bone health. So thank you very much, and we look forward to talking to you again.